So, Geoffrey, thank you for joining me to talk about the workforce in the healthcare industry. I really appreciate it.
Thanks for having me.
So, we are facing a healthcare worker crisis, not enough workers, and a very big growing demand for workers. Give me your assessment of where we're at.
Yeah, I would say, without question, healthcare systems around the country are certainly doing more than they were before to really think about how we invest in career mobility, how we partner with our academic partners and even K through 12 to build our future workforce. But I will say, from a true assessment standpoint, I'm still extremely worried and concerned because at the same time, we have so many people leaving the workforce to retire or leave entirely just to move on to other opportunities. We don't have as much supply that is presenting to become, meet the demand.
And where are the biggest demands? Is it in nursing or is it in other support staff?
Interestingly enough, certainly nursing's still a huge need, right? But if you in all the work that I do, in even looking at the labor market data, what's so fascinating is that so many of the areas that have the biggest demand are areas that we didn't always think would be the case. So things like imaging, actually, technologists, massive shortages in that space. Certainly all of allied health, certainly those roles like medical assistant, surgical technologist, pharmacy technician, all the areas that also lead to other roles and opportunities from an internal career mobility standpoint, we're still at a significant disadvantage. And then, frankly, we can't also forget, even at a doctor, at a physician level, there's some data that suggests we're also heading for some significant challenges there as well.
Some of the challenges are expenses. I mean, it can cost a lot of money to go through some of these programs. Is that what you're seeing? Is that what's keeping people back? Or is it, I'm going to just throw another idea out there, is it lack of information to know, how to go on that career path?
Yeah. I think it's a multitude, right? I mean, I think to your point, we still have significant challenge when it comes to accessibility, affordability. We also have, in many ways, at times, a higher education structure that doesn't necessarily meet learners where their needs are at. And what I mean by that is, for example, there was a Wall Street Journal article not too long ago that suggested a lot of 40 to 50-year-olds are actually looking for that more stable job opportunity. Well, healthcare tends to be a fairly stable job opportunity. But if you're a 40 and 50-year-old, the opportunity to come into a clinical role may have barriers depending on what also you have to do at home. If you have children, if you have parents you're taking care of. So we still have, sort of a system that is a bit challenging to navigate to really make it happen quickly.
And a lot of the roles, even for nurses, doctors, allied healthcare workers, there's a technical part of it. What are you seeing when it comes to upskilling the people to do those roles or even train them to do those roles from the start?
Yeah. I think to your exact point, clinical placement or what we call clinical experiences is a huge bottleneck actually throughout this country. We have less educators and preceptors who actually want to help to educate our nation's healthcare workforce of the future. And a lot of that is because of the burnout and the other challenges that exist within our system. That obviously creates a lot of challenges because ultimately our students need those clinical placements and experiences to actually become that licensed clinician, whether it's allied health, whether it's nursing, whether it's all the other areas that we've talked about, you need that. I think as it relates to this topic, though, there's definitely been more of an emphasis. In fact, I was part of a project where we worked with a healthcare system that really actually focused entirely on the idea of actually moving a workforce that was predominantly in roles like food services, environmental services, or used to be referred to as housekeeping in the hospital. Other roles like security officers, that actually investing in them to earn critical allied health certifications to grow their career to become a surgical technologist. But then don't just do that, but also create the opportunity for them to develop a pathway right into nursing or right into another critical role. We're seeing a lot more emphasis, and I'm encouraged when I see that type of emphasis.
I think that's a good point, really good point. And I've heard this before is turning to the workforce that you have, maybe in support roles, They know the system, they know the people, they know what's probably expected of them, but then helping them along the way, because I've heard of it happening in teaching as well.
Mhm.
I just did a series for CWI Labs on apprenticeships.
Mhm.
So, very much so, taking the incumbent workforce and then helping them along. I remember heard something. You had talked about University of Wisconsin might
Yeah.
be one of those, kind of a good example. Tell me a little bit about what they're doing.
Yeah. Yeah, I can't say enough about what Dr. Bridget Willie and her team have done there. They have truly built, I would say, in my experience and all the work that I've had the privilege to do, one of the best workforce development platforms that a healthcare system could ever have. They started with a program called HOPE, which stands for Health Occupation Professions Exploration, which is all about getting middle and high school students to learn about healthcare roles, uh, determine if it's of interest. Then the students that are interested have an opportunity to go on and actually explore the roles like a youth apprenticeship. And they've now developed 14 to 15 different youth apprenticeship options in the hospital where they're actually working. They then actually have training opportunities for those youth apprentices to become apprentices and do so actually getting the training certification that allow them to be a practicing clinician, such as a medical assistant, a pharmacy technician, etc. And then what they did as the next step, which I think is even more exciting, is they built 3 apprenticeship degrees with their local technical college, full apprenticeship degrees where they're actually learning and earning on the job. And remember, in this model, they're already working. They're a CNA, for example, working on a nursing floor. They're earning and learning to become a registered nurse, or in some other cases, they're learning and earning to become a respiratory therapist or a surgical technologist. And so they developed all 3 as apprenticeship degrees with the technical college.
So, what is Risepoint doing to bring all of this together and help uplift these employees and fill critical roles?
Yeah. So our work is in a couple of ways. I mean, one of which is that we support today, uh, a number, roughly 15 different pre-licensure nursing programs, all at the levels of ASN, ABSN, DMSN, and then all the way through post-licensure. And so we have the full continuum, particularly in that nursing space. We're also working a lot with healthcare systems to look at, if you want to invest further in taking a CNA or a patient care technician and grow them into nursing, really having that flexible, modern learner educational solution that allows them to still work, but also earn that nursing degree. The other piece I would say is really, as we further understand the needs are growing so much in things like respiratory therapy. So a lot of our work is also spent with the industry, the employers, to understand what other needs and then how do we work with our academic partners to drive those solutions back to them?
And what will it mean, maybe to the healthcare system and the economy as a whole, if we can lift up others into these really critical roles?
I will say for one, ultimately, we have to remember that this all comes back to the communities that we serve. And, I started in healthcare. I'm the son of a nurse. What my mother contributed as a single mom to become a nurse and what that meant for our family in many ways is what this can mean to so many other families. I would also add that when we think about the importance of these types of opportunities from a pathways perspective, to your earlier question around career mobility, or I'll also call it economic mobility, it also means that in some cases, we're also improving the diversity of our healthcare workforce, which is still super important because when our workforce better reflects the patients that we serve, we know the data always suggests that the care is actually better, the quality of the care is better. And so ultimately, when I think about our healthcare workforce, I always come back to the quality, the patient care, and as well as the importance of advancing health equity.